The content shared here is for informational and educational purposes only and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. If you are experiencing a medical emergency, please call 911 or contact your local emergency services immediately. If you follow this podcast, you already know my story. But for those of you who don't, my name is Ruth Ann. My husband, Lance, was a service-connected, disabled U.S. Navy veteran. He was sick for 25 of the 27 years we were together. He had 2 rare blood cancers. And for the last 12 years of his life, I was his full-time caregiver after he was diagnosed with dementia in his late 30s. During that last decade, I lost track of how many times I had to call 911 for emergencies related to his medical conditions. There were so many things I didn't know then that I wish I knew, and there are still things I don't know. So today I have a special guest here from the fire department who's actually going to do a multi-part series with me, answering some of these important questions. This episode will be especially helpful to caregivers, people with chronic conditions, the elderly, or anyone living alone. But it will also be beneficial to your everyday average person because nobody knows when an emergency is going to happen, and it's always a good idea to be prepared. So I hope you'll stick around. Tom, I cannot thank you enough for taking time out of your very busy schedule to answer some of these questions for us. Can you tell us a little bit about yourself and what it is that you do?
Yes, thank you. So I'm currently serving as the EMS chief for the Nampa Fire Department. I've been a paramedic for 36 years, full time. Worked in a urban setting in New York and came out to Idaho, flew with St. Al's Life Flight for about 10 years. And then got the opportunity to come over to the fire department and have worked there for 21 years now with Nampa.
Well, thank you so much for your service to the community.
Thank you.
Well, first of all, I want to start off with preparation and documentation. And this is something that I ran into a lot, something that I didn't know what I needed in the beginning of having to call 911. Can you tell us what essential documents people should have always available for emergencies, and where should they keep those documents?
So the most important thing we need in a medical type scenario or a medical situation is going to be their past medical history, obviously name, date of birth, and their past medical history, along with any medications they're taking and any allergies to any medicines they have. There's a couple places you can keep those. They did the vial of life for a lot of years, which was a vial that you'd keep in your refrigerator and you'd put a sticker in the refrigerator. So everybody knew, the responders would see the sticker and go, oh, I know if I check in the refrigerator, I'll find this little vial that has all their information. That was amazing and awesome. One of the things from my own experience, we found is people didn't update that list. So they had, the day they put it in, they had their current meds and current allergies. 5 years later, we go grab that, and those meds are different, and those the sometimes the allergies change. So if we have a current list, the best place is probably the front of your refrigerator to put that. Some people use their discharge instructions if they were in the hospital because it includes a list of all their current medications and their allergies, along with all the vital information we need to take care of somebody and transfer to the hospital so that they can get all your records and get you taken care of. So my recommendation is the refrigerator is probably our best spot for it in your home. Cars, they do have a yellow tag program, which is adopted in Idaho, however, not funded. I think Utah has funded and is aggressively doing it. But they put a little yellow sticker on your back window. So if you're in a car accident, we know to look in your glove box, and it has a similar kind of thing. The car one, worries me a little bit because not everybody in the car will have that information. But if you're a diabetic or something that you could need medical help, the bracelet and that information in your glove box would be huge. And that's another thing, the bracelet, if you have a do not resuscitate or post form. We used to call it Comfort One here in Idaho, but it's now Post, which is a physician order scope of treatment. And if you have one of those, having either a necklace or the wristband that shows that um, really helps us quickly identify and be able to start taking the appropriate treatment that you wish.
I'm wondering about like implanted devices and stuff like that.
So if you have a pacemaker, the port, so a lot of people in cancer treatments will get uh, either a PICC line or they'll end up with a indwelling catheter that's a port. They give them cards. It's pretty obvious when they have those because you can see them out of their body, and we pretty much can identify and understand how to access those. And we are trained to be able to use them in a last resort. Our goal is not to use those as the first access. We'll still try an IV or do an interosseous, something like that if we need access. But if we have no other ability to get vascular access, we will access those ports. We just don't want to damage them because it is a surgical long-term, right? It's kind of hard to get those put in, and us making a mistake and damaging those could be detrimental to their long-term care. So we try to avoid it, but if we have to, we will use them. Implanted devices like a pacemaker is pretty obvious that you can find those really quick. There's some new seizure type stuff where they're implanting some stuff into their some wires with a device that goes behind their ear to try to stop some of the seizures with a little bit of electrical current. Those things, a card would be super helpful so we know they're there. It won't, I for the most part, it's not going to change any of our treatments, but understanding a little more of their history and why, but by finding that device helps us be able to manage that patient better.
That's great information. And those are things that I had never thought about until after I called 911 for the first time.
And somebody is standing there with a clipboard going, I need this.
I know,
Yeah.
and I'm all stressed out thinking, I don't know the answers to these questions. Can you please just help?
Yes.
So, all the more reason to have those things prepared because in an emergency, you're not always thinking, well, you're probably not on your toes.
Family members or yourself are not in the right state of mind to come up with all the detailed information that we need. Yeah.
Yeah. So do you think, I know you mentioned diabetics, but what about just the average person who doesn't really have any conditions? There's really no need to have any information like that available. Is there maybe an advance directive, but other than that?
Yeah, I mean, if you have no medications and you don't have an advance directive, you probably don't need to worry about it a whole lot. We're still going to look for it. We still try to find a wallet, driver's license, if you're not able to talk to get some information. Um, but if you definitely have medications or if you have allergies, having that information available, or even in your wallet or your purse, that we can quickly grab and figure out will help us treat that person appropriately and quicker.
And you can put that information in your phone too, can't you?
Yeah, it's really hard for us to access most people's phones. They have codes so that they don't get grabbed, right? And so a lot of times we don't know where it is in the phone, and that is something we may address later in the call, or if we're running into roadblocks and we're not getting answers, that might be something we can go to. But generally, phones are a little more difficult to get it out of.
Okay. That's also good to know because I know a lot of people who put their information in their phone thinking that emergency services is going to be able to access it. But if they're not going to be able to, then what's the point?
If you put a lock on it, we're not going to be able to access it for sure,
Hmm.
because nobody's going to know your code but you, or at least they shouldn't. So,
One of the issues that I had was I was having to call 911 so frequently, and my husband had so many things wrong with him. So I came up with a form myself where I documented all of his medications and his allergies and whatever his current health issues were. And I made sure to update it before emergency services arrived at our home every time. But for the person who maybe doesn't know how to do something like that or what information to put on it, what would be most helpful in order to streamline that process?
So that would be amazing to walk in and have that form. Um, we when we go to nursing homes, they have a form that basically is built like that, and that is super helpful because you can get a lot of information really fast, and then tailor our care to what they need. Um, for people that don't have anything like that, my one recommendation would be if you have your medication, keep them in a rather than being in a medicine cabinet scattered all over the place, put them in a Tupperware bin or somewhere where they're all contained together. So you can at least just hand us the bin. Because at that point, we can look at what the medications are and try to figure out a past medical history and some ideas on how to manage them from there. Um, it is hard, and I know a lot of people in that emergency don't expect to be in that situation. So pre-planning for that is not something that a lot of us do because you're like, that's never going to happen. So those are some of the tricks we do is, hey, where is your medicine cabinet? If we say, hey, do you have a list of your meds? What are you taking? And they're like, I don't know. Where is it? And then we go there immediately and start writing them down and identifying them. So as long as you know where everything is and contain them to one spot, it's super helpful.
Yeah.
And then if you come off medicines, please pull them out of that bin. Don't keep them in the bin, put them somewhere else. So it's like, no, these are the ones I take every week or whatever your refill schedule is for your meds.
So really, we should all be living prepared for things like this instead of thinking that nothing's going to happen to us.
Yes. At some point, ever it will, right? As we get older.
Yeah.
Yeah.
Yeah. And the reason that I do this is because it happened to us when my husband was in his 20s. You know, you don't think that anything like this is going to happen until you're much older. You know, 70s or
Yeah.
80s is what you're thinking when you're really young. 60s, I suppose, because you think that's old, but I don't think 60s is old anymore.
I have to agree with you there.
But it's a good idea to have that available. And actually, we didn't have any of that available until the first time I called 911. So yeah,
Yep.
take it from me. It's a really good idea to be prepared in the event of an emergency because at some point it will happen, especially if you're dealing with a chronic condition.
Yes.
Let's talk about calling 911 and the initial response. So, what details should callers provide when they're dialing 911 for a medical emergency related to a disability or illness beyond the basics like address and symptoms to help the dispatchers send the right resources?
When you call 911, our dispatchers are trained and they have a checklist in front of them that they walk through. We use in our system, use something called ProQA, which is a software that uses a national algorithm to ask questions for priority dispatching is what it basically is. And what that really means is a way for our dispatchers to try to get as much information to send the appropriate resources and quantity of resources that are needed for that incident, whatever it might be. So if you're calling because your house is on fire, they have a different set of questions than if you're calling for a medical problem. One of the things that happens with a medical problem, especially with somebody that has a chronic illness or family with somebody that's a chronic illness and they've called 911 3 or 4 times, is that family already knows the questions that are going to get answered or get asked, and they want to circumvent that to try to just get that ambulance coming faster. And there's a little bit of frustration there because our dispatchers still have to get through those questions before we can actually start that 911 that service, whatever's appropriate. Because sometimes we may only send an ambulance. Sometimes you get a fire engine only. Sometimes you get both. It just depends on what that, we call it code out, but when they get those questions done, what it codes out as, depends, that determines the resources that are going. So my one big ask is just be patient. The dispatchers getting through the questions they have to answer, to be able to get those resources dispatched. And even though it's frustrating for everybody, both our end, the dispatcher, and the person calling 911, that process is proven and it does work. We are working on tailoring that a little bit better. And so I think it is even better now than it was 5 years ago, as we learn to tweak and adjust some of those questions, to get the appropriate resources, and looking at data from where we were and outcomes to figure out what the best resource to get there is. But I do ask for everybody to please just be patient as you get through those list of questions. The same thing happens when a nursing home or an assisted living is calling 911. They get the same questions that somebody at a house gets. And it's very frustrating for nursing staff to try to answer those questions when they're using a medical term that just answered four of those questions, but our dispatcher doesn't know that term, and they have to go through those questions. I think you see the same thing with people at home with chronic illnesses, that they recognize that, hey, if I say this is what happens at the hospital. Doesn't always happen in the 911 system. So just be patient with it and understand this is what needs to happen until the rescuer gets there.
Okay, that's great to know. That's something that I did not know. So totally news to me. And being patient is really hard when you're in the middle of an emergency and you just need somebody to show up at the house. So I think
It
that's
is.
really good advice, though. Be patient.
Yes, be patient, answer the questions to the best of your ability, even if it's the fifth time you've said, no, I understand, this is what I need. Sometimes you just gotta just keep saying it.
Yep.
Yep,
The faster you answer the questions, the faster help will be on the way.
correct. They can get through those questions, they get the appropriate resources coming.
You sort of answered this question, but why does the fire department often arrive first in medical calls? And how does that integrate with ambulance services? What roles do firefighters play in these situations?
That's an excellent question, and I get it all the time when I'm presenting in public or anywhere. A lot of people are like, "Why are you sending a fire engine? It's a medical call." So first off, we set up fire engines. Our goal is to be within our response area in about 5 minutes is our goal. So if your house is on fire, we want to be there as fast as we can to either contain the fire or get people out so we then can put the fire out, save as much life and then property as possible. So in doing that, we've set up a really good structure for a quick response. And ambulances are set up, there's less ambulances than there are fire engines. So we end up with, in our city, we have 5 ambulances currently for almost 120,000 people, where we have 7 or 8 now fire engines that can respond to those calls. So by putting trained medical, every firefighter is a trained EMT. We have a paramedic on every engine. We have all the same equipment that the ambulance does in our portable gear. We don't have a stretcher, minus the stretcher. Everything else we have is the same. And so for us to be able to respond, a lot of times we can be on scene in 3 to 5 minutes, where the ambulance is going to take 8 to 10 minutes to get on scene. So we can get on scene quicker, start initiating care, take care of some of those major life threats, and improve outcomes by us responding with a paramedic level service faster. So that is why when we go through the dispatch, we talk about going through that, what appropriate resource needs to be there. And if you call and it's like, yeah, I just need, my doctor wants me transported to the hospital. Here's the room they want me to go to, right? Like, we don't send a fire engine to that. There's no reason to send that resource to that call. But if you call and say, I'm having chest pain, then we're going to get a fire engine and an ambulance, because that engine can get there. We can do a 12 lead. We can figure out if it's cardiac, not cardiac. And then we can alert the cath lab if we identify a cardiac problem within a minute or two of our arrival, which gets your time to cardiac catheterization and getting that heart attack fixed, can drop it by 30 minutes to 45 minutes sometimes in your long-term care. So having us respond, having fire departments respond quicker can get the appropriate care to that person faster, especially in life threats. I know some people do get annoyed because there ends up being about 8 to 10 people that show up on some calls. And it feels like you have too many resources for what you need. But in a true life-threatening problem, we need that many people to be able to get everything done and efficiently manage that patient.
I will tell you from my own experience that the more people there, the better, because it meant that that was less that I had to do. It was such a relief to have anybody show up and take control. So, well, this question is really going to be for people who have someone in their life, a loved one or a friend who's a non-English speaker or has communication disabilities. This is something that you should be aware of that you could relay to your friends. What tips do you have for effectively conveying information during a 911 call?
With Google is amazing because they have that language transition line now. So pretty much any phone can do a translation, which is one of the tools we use. We also subscribe as our medical system, our emergency medical system in our area, subscribes to a translation service. So we have, I think it's 32 languages that we can call and instantly have a translator within a minute of calling that line to be able to communicate with people, which is super helpful. We do have some refugees that end up in this area, and sometimes they're not the normal Spanish speaking that we have in our area, which a lot of our guys have learned little bits and pieces of Spanish so we can have some communication while we get this translation service set up. But when we get a Bosnian or somebody from a refugee kind of camp, it's even more challenging because nobody in that area understands that language. And that's where that language line is huge. But Google on your phone, if we show up and you have your own phone, you can set it up so that we can be reading or Google can translate for us what you're trying to tell us. And I think that would be a huge tip for anybody if they just have that up and ready to go. Because if you are if you don't speak English as your primary language, that is probably going to be the biggest hurdle as we try to identify what's going on and what you need for help. So that Google language line has been incredible, or iPhone language. I don't know. They both have their own translator services. Either one works great.
Have you ever run into any problems where communication was such a problem that you had a hard time navigating through it?
Yes, I've had many calls where we've had that challenge, and some of it can be done by pointing and some grunting. It doesn't always get effective communication, and a lot of times it's like, let's just bring them to the hospital and they can get an interpreter and figure it out, which is one of the reasons we got the language line now, which I think is huge for our guys. Most areas, like we have 6 employees now that are bilingual, and we actually pay them a stipend. They have to take a test and prove that they can bilingually speak. The police department, our local police department, has several officers, and they try to adjust them so that 1 or 2 per shift that are bilingual with the most common languages spoken in our area. So that has been a great resource since we started doing those type things. Uh, because you have somebody you can call that can translate for you. The one downside of Google, I should add, is they don't understand medical terminology. So sometimes the common language works great, but when we start asking like actual medical history, the Google gets a little confused. It doesn't know how to answer those. And that's why we have the interpreter line, because they are trained as medical providers, not providers, but they understand the medical language to be able to help resolve some of those confusion issues with language.
Well, let's move on to safety considerations. What safety measures can households take to protect both the patient and emergency responders during a medical call?
So in the chronic illness person, especially one that's bedridden, a lot of times the living room gets adjusted and turned into almost a hospital room, right? And they have a hospital bed and a lot of the stuff in there to try to make them as comfortable and as easy for the family and care providers that are assisting them to take care of them. The one, for the most part, most of the home health agencies are really good about getting pathways so that we can get a stretcher in and out of there. But just try to keep a clear path so that we can get the stretcher next to them and easily transfer them over for their comfort and to prevent injury of our guys, and then get them out of the house. Um, the pets one is an awesome one because the pets are super nice and will never bite you, but they get a little scared just like you are, and your fight or flight are going a little bit as this is like a stressful situation when we arrive and that pet senses your anxiety that's going on. And even though they're super nice and will never bite, they do sometimes nip and bite at the responders that are helping. So we do ask for them to be either in another room or pinned outside or in a secure area, so that we don't have to worry about tripping over them or them getting upset or trying to just delay the care that needs to be provided or transport. Oxygen cylinders are a good one. We're pretty safe on those for the most part. They come in little carts. You don't want to leave one just standing up on its own. I believe most of the home oxygen now is through a liquefied oxygen that has a process that makes it into oxygen. And so we don't actually have tanks that are laying around, which is good. And we do bring our own tank and we will switch anybody over to our stuff for the transport, just because it is what our guys are most familiar with and really used to using. And we can secure them appropriately in the ambulance for the transport. Um, as far as general household stuff, if you have the ability, for a chronic person or somebody living alone, if you have the ability to put a lockbox on the outside of your house, I recommend a lockbox, not just a key under the mat, but actually do a drilled in, screwed in lockbox with a code to put your house key in. That if you are unable to get to the door, that is a super easy way of us being able to gain access without having to break into your door and then have to figure out how to secure the door afterwards. Because a lot of times when we break into a place, it may not be able to be locked when we're done, depending on how urgent we feel we need to get into the building. And it could be a significant delay in us getting care to you. So if you're living alone, you can either give that code to the 911 center. If you call the fire department, you talk with them. The Fire Prevention Bureau, usually in most places, have the ability to send that code to dispatch and they put it in under your address. So when your address comes up in the 911 computer, that code pops up. We will not say that code over the air. So but it shows up on their computer in the engine and they know the code to be able to get into your lockbox to gain access to your house. Some people use a garage door code key. That works too. And they just leave the garage door unlocked. So you're able to open the big door, garage door and get in. But a lockbox key would be a highly recommendation if you're living alone or you may not be able to get to a door.
Are you saying that it's a good idea then, if you get that lockbox, to contact who to get that put into the system so that if you do have to call 911, it's already there?
Yep. So your local fire department will be able to guide you and where to go if you call their administration office. Um, we have a system that our Fire Prevention Bureau, which is part of the fire department, they do the building inspections, sprinkler inspections, those plans reviews. for new construction. They're the ones that we have take care of it on our department. And so they will send a message over to dispatch and have that entered into the CAD. The computer aided dispatch is CAD. And they have that lockbox code in that system so that when you call 911, our crews will be able to access that and not have to break into your house.
That sounds like a really great idea.
Yes.
Well, since you mentioned people living alone, do you have any other tips on safety for people who live alone?
Living alone in our aging population, and I hate using that term nowadays because I think I'm included in that. But as we get older, our ability to you shuffle more than lift your feet up sometimes. And so throw rugs is probably our biggest concern with people. Everybody has a little rug in front of their kitchen sink, a lot of times in the bathrooms. And if you stub your toe on the corner, it folds up a little bit. Next thing you know, you trip and break a hip, which is horrible. So we don't want that to happen. There's a lot of older population that we show up, and we will find 3 or 4 of those rugs stacked up in a row in front of a door, or on the way to the bathroom, there's all these different rugs so that those are trip hazards. And if anything that's a trip hazard, you want to get picked up. And if you're going to use a rug in front of your bathroom sink, which I understand, you don't want to stand on the cold floor, please put the double-sided carpet tape on it so it doesn't slide out from under you and you're not going to trip on it. That is huge. That's probably our number one. We've had an influx of older people into our community. Our trauma center now, the most common level 1, which is our worst traumas that we see this last year, has been from falls of the elderly with broken hip. A broken hip by itself is not a big deal, but when you have high blood pressure, cardiac disease, diabetes, other medical problems, we call comorbidities, that turns into a really bad situation for those people. Sometimes the beginning of the end for them. And we don't want to see that happen. I totally want people to have as much um, autonomy or ability to be able to be on their own without help as long as they possibly can. And throw rugs are probably our biggest enemy when it comes to that. So the other suggestion we have is grab bars in the shower. I know everybody's like, I don't need those, but it only takes a little bit of soap in a second and you're on the ground. And again, injured pretty bad. So people with blood thinners, that can be a really bad outcome as they hit their head and could have worse bleeding from that. So recommend grab bars in your bathroom. Grab bars by the toilet helps too, because sometimes just getting up, you need a little bit extra grab. And grabbing the shower curtain will not help you. You'll end up on the ground. So if you have something solid, which is why we recommend grab bars and put them in when you're younger, so that as you age, they're just there, is our biggest recommendation.
Well, what age would you recommend putting them in at then?
So I truly think in the 50s is when you need to start installing that stuff. Maybe early 60s at the latest, because once you hit in that 70 range, late 60s, 70s, we're starting to see people with instability. You tend to be on a little bit of medications, and sometimes when you stand up quick, you get a little woozy and lightheaded, and having something to be able to grab onto that's solid is huge. Throw rugs, I don't think we need to secure those even when you're in your 20s. It's just you recover better from that fall when you're in your 20s than when you're 60s. So yeah, highly recommend double-sided carpet tape for any carpet that's not nailed down in your house. So if you're living alone, as you get older, a lot of times if you do fall, you may not be able to get to a phone or get to your, we don't have landlines. Everybody has cell phones now, but it may not always be on you, right? Might be on the bedstand charging or wherever you charge it. You might fall in the living room or in the kitchen while you're getting coffee and your phone's in the bedroom. That's going to be pretty painful to try to crawl in there to get help. So one of the things I highly recommend is the Lifeline, or there's probably 30 different companies out there that have those, but some kind of button. It's a necklace. Some of them have a like a watch like thing you can put on your wrist if you don't want to wear a necklace for the guys. But something where you can hit that button to say, hey, I need help. I've fallen, whatever, right? I just need help. And you don't have to try to crawl to your cell phone that might be 2 or 3 rooms away from where you fell. Most of those are waterproof, so you can wear them in the shower. You don't have your cell phone in the shower. At least I don't think most people do. So you that it will be with you anytime you need it. And I really think that has been a huge lifesaver for the people that have had them. And I've seen people that didn't have them and have laid on the floor for hours, some of which didn't make it because they weren't able to get to a phone and call 911. And we went there on a status check 2 or 3 days after they fell, and found them, right? And to prevent that, having that button, I think most of the plans are reasonably priced that you can afford it even on a fixed income. Um, and it's a huge insurance policy that you're going to get help and allows you to maintain your independence, because you can live longer by yourself, knowing that you can get help there, versus, yeah, I'm a little wobbly. I can't move as well as I used to, but I don't want to be in a home and I don't want home health. Uh, that's where that button really comes into a huge benefit for those people.
Is there an average age for people to look into that, or does it just depend on your level of ability?
I think it turns into your level of ability, truly. I, I would hazard to say, so I say this, I've seen 50-year-olds that look like they're 90 and they're in nursing homes already. And I've seen 90-year-olds that I thought was 60 that are still spry and running around crazy. So there are exceptions to all this, but generally speaking, that upper 60s, 70s is probably a good idea to have those at that point. But depending on your medical conditions and what's going on with you, you might be a 40-year-old with one, and that's fine. It's no big deal. That's what you need. I think it's great. Or you might be 80 before you decide, no, I need something, right? But that as we age, we know our dexterity declines, we know our sensation declines a little bit, and that's when you're at higher risk for falling. Um, and that's when I think it's super important to have something like that.
I have one final question for you for this episode. And I'm just going to say this was when I was taking care of my husband. He used a walker at home. He used a wheelchair whenever we left the house. So he had mobility impairment. And I was always with him when he walked around the house because it was that bad. One of my biggest fears was our house catching on fire, especially in the middle of the night, and being trapped in our room, because I knew there was no way I was going to be able to get him out of the house safely, and he moves slow. So even if we did have to go through the house, is he going to make it in time? So how can caregivers prepare for scenarios where the patient's disability might complicate evacuation or treatment, like mobility issues or sensory impairments? I know my least favorite holiday was the 4th of July because I knew that the fire department was always tied up, and I was so worried that our house was going to catch on fire.
That is probably one of our busiest days of the year. And yeah, I think last year we ended up with 2 house fires that on the 4th of July. So from fireworks, right? Like that's, yeah. So with trying to get out, my one recommendation, this is the downside of having somebody live in the living room versus a bedroom. If you're able to keep them in a bedroom, I recommend that everybody sleeps with the door closed. Because if they're and have good working smoke detectors. Because if that smoke detector goes off and you identify that there is a fire, That door, closing that door and then taking a towel or a blanket or something and stuffing it around the bottom of the door so that it minimizes the smoke coming in. And then making that 911 call telling us exactly where you are in the house. We will do something called, we call it VES or vent enter search. And what we will do is at that point, we know we have a fire and we know we have you trapped in a rear bedroom, wherever it is. We will come through that window and bring you guys out of that building from that direction. So you don't have to go back through the smoke and through the fire. I don't recommend doing that, especially if you're not moving fast. Fire grows really fast. And even if it is a super small wastebasket fire, if you're not moving fast, it can involve the whole room within less than 3 to 5 minutes. And if you're moving really slow, you can end up getting caught in that expansion of the fire. So close the door, seal it, get a hold of 911 so we know exactly where you are. And our crew's first effort on the scene will be rescue at that point. We will do our best to get you guys out. Either that first engine, we'll probably do that Venator search and get you out and then go to fire attack, or that second in engine, depending on where you're living, we'll go to rescue and one will go to contain the fire. Because if we put the fire out, everything gets better. But if we can get people out too, it gets better. So those are kind of simultaneous goals that we strive for really quick. The other big thing is to have working, the working smoke detectors is huge because it gives you early identification that there is something going on. So making sure you change your batteries yearly. We recommend a holiday like Christmas, or 4th of July could be your holiday. Whatever, create a holiday that, hey, I'm going to change all my smoke detector batteries and make sure they're working throughout the house, especially if you have somebody that can't get out quick, either being overweight or being handicapped or with an illness. And then the other thing is to have fire extinguishers. If you have them available, you can use those to help you to be able to contain something or stop it while we're responding.
So seal the door, call 911, and do not open your windows.
Opening your windows can be a double-edged sword. So it can be good because if you have smoke in that room, you can bring in some fresh air, and I think that is very good. But also remember, you are adding what we call a flow path. So now once we've opened that window, air is able to get in, and we know fire needs air, heat to expand and fuel to expand. And so if we're adding air to the fire, there is a risk that the fire could get bigger, depending on where the fire is or where it is. So if your room's not filled with smoke, you're probably okay leaving the window closed. If you're able to isolate yourself from the fire and open a window, you're probably in a good spot. We just have to know that if that door gets open, we're now feeding oxygen to the fire.
Okay.
We're going to have to open the window to get you out. So it will happen.
Yeah,
Our
but
goal is to be able to have fire lines in place to contain the fire while we do that. So it looks like organized chaos, but that is we're trying to multitask on those fires and put different companies where they need to be to mitigate the worst of the situation that we're going to create.
I wish that I would have asked that question while my husband was still alive, because that stressed me out every single year for whatever the 3, 4 weeks that people shoot off fireworks. I would like to say people just stop shooting off fireworks. It's dangerous.
Yes, we had a lot of grass fires this year from it. And then we had 2 fires where people thought the fireworks were extinguished and put them in their plastic trash can next to their house and lit their house off on fire. So,
Well, you have answered a lot of questions for me. I appreciate it so much. Is there anything we haven't covered that I haven't asked you that maybe you would like to add?
if you have, there's a post form or DNR form for Idaho only allows the post form now, which is physician order scope of treatment. And that is not only for I don't want to be resuscitated, but it's I don't want to be on a ventilator, right? I want try full efforts, but don't put me on a ventilator. Or like, yeah, you can defibrillate me, but I don't want CPR. Or I want CPR, but don't defibrillate me. Whatever your wishes are on that form. If you are choosing, and I say that because most people with chronic illnesses, the physicians have this discussion with them. The biggest thing we need is that form. Um, we can accept a copy as long as it's not mutilated and crumpled up and hard to read, because now we question if it's valid. But as long as we have a valid form with good dates, even if it's a photocopy, we can honor whatever is on that form for their wishes. The one thing I do want to say, which has happened, and it just happened recently to us, is I got involved after the fact on this one. Um, Sometimes with our elderly population, we have one sibling, they have two or three brothers and sisters. One sibling is similar to you, taking care of mom or dad, and they're the ones taking them to all the doctor's appointments. They even might be living in their home, right? They're the ones that have constantly been through the struggle of what they are going through. And that a lot of times towards the end, they then call their brothers and sisters. A lot of times don't live in the same state, and they come up for that final few moments. And that person that's coming in hasn't seen the the time, the stress, the environment that they've had to live through, and may not be totally okay with the wishes of what that person wants, and sometimes won't let go of what they used to have compared to what they have. And I think that person that's been the caregiver saw that person transition from the strength and decline to where they are today and are okay with and have had time to process being okay with their wishes of ending of going down that route. What we have happen is that sibling then shows up and is creating a huge scene about you have to do everything, and it puts our crews in a gray area conflict because technically we have the DNR that says that person doesn't want wishes. However, they are now unresponsive, not talking, and are unable to convey. So we have to go on what the caregiver wants, and there's a gray area. So we don't know the whole situation or who they are. There's a gray area on who truly is the caregiver and who has power of attorney. So my ask to families is not that situation is always going to probably happen. There's always going to be hardship with that sibling or that other person that's coming into the middle of this. Um, my ask is that people try to take time to educate and have those conversations before that happens. Hospice has been amazing at facilitating a lot of those conversations with people and have reduced this greatly. But there is a lot of challenge on that scene when you have conflicting, like, work them, don't work them. I want everything done. I don't want anything done. That's not what he wants. And now our crew, who is dealing with a life-threatening situation, if they're going to intervene, they have to make a decision in a couple seconds. They don't have time to get the big picture. Has to make a decision that, okay, let's start CPR for right now. Let me figure out what's going on, and we'll try to, and then that just creates a lot of conflict. So having those loved ones have that hard conversation with the other loved ones, and it may be introducing that topic several times before you come to the final, like, okay, I'm okay with what we're doing. I think it really helps the family stay together and less conflict and less trauma in that moment. Because that's probably the hardest thing. And I understand both sides of it, and I have empathy for both sides of it. It's hard. But that has created some conflict on our scenes. And so even though it sucks, having those hard conversations before that moment happens, really kind of just helps everything on that scene.
Yeah. Those conversations are hard to have, but they are so important. In addition to having those conversations, though, would it be helpful to have the power of attorney? In my case, I was my husband's legal guardian, so I had the guardianship papers and I had all of that ready to go. So, would that, if you have that paperwork, does that give you the power to make that decision?
Yes. I
Okay.
will tell you, we have a caveat in all of our protocols, and I'm pretty sure nationally everybody has an out too. Like if there's going to be a riot on scene or a conflict that's creating like a uh, unfavorable, violent kind of situation that we're we are going to end up working them or choose not to work them because we don't want to put our crews in danger or further escalate that situation. Our crews will call for law enforcement is sent, I think almost nationally now, maybe not everywhere, but majority of the places. We talked a little, and I don't mean to step back too far, but we talked a little bit about fire departments with their response time, and ambulances are have a little bit longer response time. Well, police officers tend to be patrolling, and a lot of times they might be in their car a mile from your house. And so we have AEDs and we train our police officers to do CPR. So we dispatch a police officer immediately to something that we think could be a potential cardiac arrest so that they can start intervening if they need to while we're responding. And it just gets care to that patient even faster. So a lot of times these calls, we end up with a law enforcement on scene. And they do try to help and jump in and try to de-escalate any conflict that's occurring and try to resolve it. But to truly look at that paperwork and truly prove what's going on, you're looking at 4 or 5 minutes of conversation, reading, and coming up with an answer. And if somebody is not breathing, we don't have the 5 minutes if we're going to actually intervene and make a difference. And if we find after that 5 minutes that they actually did have the right to say, yes, we need to do it, we didn't help that person. So our crews are going to, by default, start CPR. And we can always stop if we find the wishes later. So if there's conflict, our crews tend to start the resuscitation, even though they're like, I don't think we should be doing this, but they're like, let's start. And then we can always stop once we prove what's going on. But yes, I would highly encourage DNR paperwork or post paperwork. If you have a power of attorney, having that with you is amazing and awesome. I know it's hard. I was power of attorney for my parents, and I had it on my phone so I could just bring it up at any time and show I had both medical and durable power of attorney. And the forms were there. So if there was any question, right, I had them available to me. Um, but yeah, having that available would be huge. Um, it may or may not, if you're in a conflict situation, it may or may not help it. And we're all just going to have to do what we can to mitigate that in the moment and de-escalate it as much as possible. But having those pre-conversations, that is what resolves that conflict. So we don't have it to start to begin with. So yes.
Well, that was my last question for this episode. I've got a whole other set of questions for another episode. I cannot tell you how much I appreciate you answering these questions, and I know that it's going to be helpful to everyone who listens to this.
If we can make a difference on one call, it's helpful, both for our guys and for the people that we help.
Well, it made a difference for me already, so I know that this is going to be helpful to other people. So thanks again, and I will see you next time, Tom.
Thank you.
Thanks so much for listening today. If you're a caregiver, a family member, or just someone who might need to call 911 someday, this is the kind of information I wish I'd had 15 years ago. So please hit subscribe so you don't miss the next one, and share this episode with someone you love. You never know when a friend, a neighbor, or family member will be staring at their phone, heart pounding after calling 911, wondering, why is the fire truck here? EMS Fire Chief Tom will be back in the next episode to answer more of those questions that I used to lose sleep over. So let's get this out there. Together, we can help the next family be a little less scared. I'll see you in the next episode.